Welcome to the deep dive, where we cut through the noise to find the truly essential. Ever felt that gnawing anxiety before a major medical procedure?
Oh, definitely. It's more than just feeling uncomfortable, isn't it?
Right. It can actually derail life-saving treatments. Sometimes procedures even get delayed or, well, canceled because of it.
It's so true. That emotional and, physical toll of pre-surgical anxiety, it often gets completely underestimated. But its impact on patient well-being and even surgical outcomes can be quite significant.
So what if the most powerful intervention wasn't, say, a pill, but something, well, ancient, deeply personal, and totally non-invasive?
An intriguing idea.
Yeah, so today we're diving into a really fascinating study. It kind of challenges our assumptions about healing, especially for Muslim patients facing neurosurgery.
Okay.
Our mission is to guide you through this study's design, its pretty remarkable results, and what it all means for understanding that mind-body connection in healing, so you can quickly grasp what's really important here.
It's an intriguing intersection, isn't it?
Yeah.
Belief and biological response. It really demonstrates just how powerful the mind can be.
So let's start by really unpacking this big challenge of pre-surgical anxiety. We know it's common, right, before lots of surgeries. But what about for neurosurgery candidates, people facing complex brain operations? Is it worse?
That's a critical point. Yeah, while anxiety is common, it definitely tends to be particularly acute for neurosurgery candidates.
Okay.
I mean, think about procedures like a craniotomy surgery to actually open the skull.
Wow, yeah.
The nature of these brain and nerve operations, well, it can induce really profound levels of fear and emotional distress. It's not just the uncertainty, it's the perceived vulnerability, the life-altering potential.
And the stakes here are incredibly high, aren't they? It's not just about making the patient feel a bit better before they go in.
Not at all.
It's about literally improving their chances of a good recovery,
Yeah.
avoiding those critical delays.
Precisely. Managing this anxiety is crucial. It affects patients physically, emotionally, and that can directly impact surgical outcomes. High anxiety can lead to, well, less favorable recoveries, like you said,
Right.
and even cause cancellations or delays in really important procedures. So finding effective ways to help is vital.
Okay, so given those high stakes and knowing that maybe medication isn't always the first or only answer, what other kinds of approaches are out there? These gentler methods?
You mean the non-pharmacological ones?
Yeah, the things to reduce that fight or flight stress response without drugs.
Well, there's quite a diverse range, actually. You see things like specific exercise programs, dietary changes, various relaxation techniques. There's even something called book therapy, using specific reading materials to distract and soothe. And of course, soothing music. These often fall under complementary medicine.
And what makes these non-drug approaches so attractive for doctors and patients?
They offer some real benefits. They often work, they can be more cost-effective, they carry very little risk, and they're non-invasive.
Easy to implement them.
Exactly. Makes them easily implementable alongside standard nursing care without adding complex medical stuff or the side effects you might get with drugs.
Music therapy is something I think a lot of people connect with personally. How does that play out in a medical setting? Has it shown real effectiveness?
Oh, absolutely. Therapeutic music has indeed proven pretty effective. It can reduce anxiety, feelings of loneliness, even excitability. It generally improves mood.
Okay.
It helps facilitate emotions. And some studies show it can even reduce stress indicators during surgery, like heart rate and blood pressure. So it's a valuable tool.
Now, this is where the study we're looking at takes a really unique turn. It introduces something a bit different, framing the recitation of the Holy Quran as a kind of soul-enhancing music. How does that fit in?
Well, it's presented as a powerful, non-pharmacological spiritual approach for managing anxiety, similar in its intended effect, really, to psychological or cognitive therapies. The idea here is that the melodic qualities, the phonetic qualities of the Quranic recitation, even beyond just the literal meaning, can have a profoundly calming effect.
So how did the researchers actually test this? What kind of scientific setup did they use to see if the sound of the Quran really makes a difference?
Right, so this was interventional research. They actively introduced this listening experience and measured what happened.
Okay.
And crucially, they used a pretest and posttest design with a control group. That's really important for good research,
Gold standard, yeah. So you can actually see if the intervention caused the change.
Exactly, not just random chance.
And who were the participants? Who were they focusing on?
The study looked at 60 Muslim patients aged between 20 and 60. All of them were candidates for brain and nerve surgery in teaching hospitals.
Okay, specific group.
Very specific criteria. It had to be their first hospitalization for this kind of surgery. No hearing problems, no addictions, no diagnosed mental illnesses. And critically, they all had a score of 41 or higher on the Spielberger anxiety scale.
Ah, right. That scale measures anxiety level.
Yes, it's widely used. A score of 41 or more indicates moderate to severe anxiety. So they were studying patients who genuinely needed some help with anxiety.
Got it. And they weren't taking painkillers or anti-anxiety meds at the time?
Correct. That was another exclusion criterion.
Okay, so they had this specific group. How did they divide them up? Experimental versus control.
It was random assignment. 30 patients went into the experimental group and 30 into the control group.
Fair enough.
And the researchers were careful. They checked that things like age, gender, marital status, education, job, even history of high blood pressure. All that stuff was statistically similar between the groups before they started.
So a level playing field.
Exactly, to ensure a fair comparison.
What about the control group? What was their standard care? Was it just good luck?
No, it was more formal than that. It was a proper protocol for psychological preparation. It involved informing, educating, familiarizing the patients and their families about the surgery, the potential complications, all in simple language. They got pamphlets, verbal education, face-to-face meetings.
So a pretty comprehensive standard approach to manage anxiety.
Yes, exactly. Preparing them for the surgical team in the process.
Fascinating. Now, the experimental group, what was the specific thing they received that was different?
So for the experimental group, right before they went into the operating room, they listened to selected verses from the Quran,
Which ones?
specifically Surah Fajr and Hijrat. They listened for 20 minutes through headphones.
Okay.
The recitation was by Mohammadi Manashavi, and importantly, they listened in a quiet, secluded room to minimize any outside distractions.
20 minutes of focused listening. And after this, how did the researchers measure the impact? How did they quantify anxiety and those physical signs?
They used two main tools. First, that Spielberger anxiety scale again. It measures both situational anxiety, they call it overt, and the more underlying personality anxiety, or covert. Scores run from 20 to 80, indicating mild, moderate, or severe.
Right. And the second tool?
A vital signs checklist, just recording the key physical indicators: blood pressure, heart rate, and respiration rate.
Okay, so let's get to the results. You said the groups were similar beforehand. What happened after the intervention? What was the big takeaway?
Well, first, yes, confirming that clean slate, no significant differences in anxiety or vitals between the groups before they started. That's key.
Good.
But the main conclusion, it was pretty striking. The sound of the Quran led to a significant measurable decrease in anxiety levels in the experimental group.
Significant decrease. Can you give us the numbers? How much of a difference did it make?
The numbers are quite impressive, actually. In that group that listened to the Quran, they saw a 53.5% decrease in overt anxiety.
Wow, over half.
Yeah, and a 40% decrease in covert anxiety, the more internal stress response.
40%.
And physically. A 21.5% decrease in heart rate, a 20.9% decrease in respiration, and a 4.3% decrease in blood pressure.
Those are really substantial changes for something non-drug related.
Very substantial, yes.
So how did the control group fare? The ones who got the standard psychological prep, did they see similar improvements?
Well, this is where it gets really interesting. The control group, despite getting that standard care,
Yeah.
they showed no significant change in their overt or covert anxiety levels,
Oh,
or in blood pressure or heart rate.
really? None.
Basically, no statistically significant change in those key areas. There was a small but significant reduction in breathing rate noted for them, but overall, it really highlights the unique impact of the Quran recitation.
It set it apart from that standard, quite comprehensive psychological prep.
Absolutely.
So this isn't just about any sound, is it? It's about how the brain responds deeply. From a neurocognitive perspective, how does something like music, or in this case, the Quran recitation, actually achieve these effects?
Yeah, from that neurocognitive viewpoint, music is seen as this complex sound language, right? It stimulates the brain on multiple levels at once: sensory, motor, perceptual, cognitive, emotional,
Happening together.
simultaneously. It integrates neural pathways in really specific ways. And that helps explain how sound, in its various forms, can have such a profound effect on our physical state, our psychological state, way beyond just hearing it.
It almost feels like humans have known this intuitively for ages, doesn't it? I think there's even a historical story about music and surgery way back.
Yes, there is. It's quite famous. Back in 1809, Jane Todd Crawford apparently played hymns while undergoing the first ever oophorectomy, that's ovary removal surgery, without anesthesia.
Wow. No anesthesia, just hymns.
Incredible, right? It's anecdotal, of course, but it really shows this long-standing awareness, even centuries ago, of music's potential power in a surgical context, long before we understood the brain science behind it.
The study mentions a miracle hidden in the music and phonetic order of the Quran. What do they mean by that? Especially the idea that it can influence people even if they don't understand the words.
Right, that concept suggests that it's not just about understanding the literal meaning of the verses. There's something inherent in the rhythm, the intonation, the actual phonetic structure of the Quranic recitation itself.
The sound itself.
Exactly. The sound itself can profoundly affect the listener. It's like the auditory experience influences the brain and emotional state in this unique way, almost like a therapeutic frequency, regardless of comprehension.
So, how does this finding connect to the wider research on, say, spirituality and religion as resources for health and well-being?
Well, it fits right in, actually. Research consistently shows that spirituality and religion can provide strong feelings of support, motivation, ways to cope with stress. Some research even suggests it can help resolve mental health issues by addressing what's sometimes called spiritual damage. This study powerfully reinforces that idea that spiritual practices can be a significant resource in healthcare, acting as a complementary way to heal.
And it seems like some studies even suggest the Quran recitation might be uniquely effective, maybe more so than other kinds of music.
That's a crucial point. Some studies do indicate that Quran recitation might be even more effective in reducing anxiety than other musical forms.
Interesting.
And this ties into a strong existing belief among many Muslim patients in the Quran's healing power. There was a Saudi Arabian survey, for instance, where 68%, a big majority, reported using the Quran specifically for healing.
So there's a cultural and spiritual resonance there that might amplify the effect.
It certainly seems plausible. That deep connection could definitely enhance its impact.
And this isn't just an isolated practice then. It sounds like it's part of a broader approach in some places.
Absolutely. You see theologians, doctors, researchers in many Muslim countries actively encouraging the use of religion-based treatments like listening to the Quran to complement standard medical care.
For various conditions.
Yes, for a range of things, from depression in dialysis patients to anxiety before C-sections, even for patients in the ICU. It shows a widespread acceptance of its potential therapeutic role across different clinical settings.
So what are the real-world implications here? For you, the listener, or for, say, health policymakers? How could these results actually be used?
The potential is quite significant, I think. Health policymakers could definitely look at these results, maybe make it a research priority. Using the sound of the Quran seems like a simple, incredibly cost-effective, and obviously deeply meaningful method to reduce anxiety before something like neurosurgery, particularly for Muslim patients.
An accessible tool, really.
Very accessible, and can be easily integrated into existing pre-op protocols, potentially improving patient comfort, maybe even outcomes.
Were there any specific limitations to this particular study we should keep in mind? Things that might affect how widely we can apply the findings?
Yes, the study authors themselves point out a couple of main limitations, which is good science, right?
Right, acknowledging boundaries.
Exactly. So first, it focused specifically on neurosurgery patients, and second, it exclusively involved Muslim patients.
Okay, so not necessarily generalizable to all surgeries or all people just yet.
Correct, which naturally leads to their recommendation for more research.
Makes sense. What do they suggest?
Well, they explicitly recommend future studies explore the effect of Quran recitation in other types of surgery, and crucially, to investigate its impact among non-Muslim populations too.
Right, to see how broadly applicable this effect might be across different cultural and spiritual backgrounds.
Exactly.
So to kind of bring this all together for you listening, this deep dive has really shown quite powerfully how a spiritual intervention, specifically the sound of the Quran, can profoundly impact both the psychological and the physiological well-being of patients facing major surgery. It's a striking reminder, isn't it, of that intricate link between our inner world, our minds, our beliefs, and our actual physical health. How things we might think of as non-medical can have very real, very measurable effects.
It truly is. This research really underscores that healing isn't just a biological checklist. It's deeply intertwined with a patient's emotional state, their spiritual state. It opens up fascinating possibilities for complementary care.
Absolutely. So given these findings, here's a thought maybe for you to ponder. How might a deeper understanding of these diverse cultural, these spiritual practices, how might that reshape our future approaches to truly holistic patient care? Moving beyond just the conventional medical stuff to embrace, well, the full spectrum of human experience.